Hey guys, welcome to the Fixed Blood Sugar webinar. We are on episode number 101. If you were here last week, you got to celebrate with us for episode 100. It is really crazy to think that we've done this many episodes, and man, have we gotten to meet so many of you through this webinar. We've been able to hear your stories, hear about your successes and the things that have been hard. And that is one of the best parts about this, is that we get to be a community that comes together and help each other. And so we're thankful that all of you guys are here. We're excited to keep doing these. And so make sure, the best part of our webinars is when you guys hop on and you tell us what's going on in your world. We want to hear from you, because that also helps us to shape our webinars, to shape our products, and to know what you guys need. So that's why we do it. So yay, we have people hopping on. All right. Feel free to let us know where you guys are tuning in from. Brian, you were on. Hey, I sent you an email today. Maybe you already got it. Yes, 101. Kind of crazy. We're waiting for Dr. Saunders here to hop on. He is busy with patients. You can see we have Joe in the car. He's not driving. His wife is driving. So safety first.
There she is. Hello, everyone. Leslie, I would just like to say, that is a great hat you've got on today.
Show. I hopped on the webinar. Here's the truth. I hopped on. He didn't even, I don't think he even noticed I was wearing a hat, actually. And then his wife complimented me. Thank you, Dr. Saunders. And then his wife complimented me. He's like, oh, yeah. Nice you and my husband both, Joe.
Yep, two peas in a pod.
Boy.
Hello, everyone. I heard Dr. Saunders, but I can't see him. I suppose maybe that's because I'm on my phone or something.
It's because you're wearing those silly sunglasses.
Oh, yeah.
There
we go.
Yay.
I was waiting for a compliment of my sunglasses.
Oh, nice. Yeah. Sunglasses. I should have complimented you.
Hey, nice hat, Leslie.
Thank you. You guys are great. I like your shirt, Dr. Saunders. All right, here we go. We've got Bill checking in from Seattle. Hello, Bill. Let's see here. Lots of people joining. Let's go ahead and get this webinar started. First of all, I'm going to have Dr. Saunders do a disclaimer for us, and then we will get started with our chat about type 2. So feel free to post your questions in the Q&A. Those of you on Facebook, feel free to comment there. We're going to do our best to answer those questions while we are live. We don't always get to all of them, but one of the things that you can do is head to bartonwebinar.com. You'll find a link to our YouTube channel where you will find all 101 plus few extra of our episodes. You can do searches in the search bar for topics that you might be interested in. So if you're curious about blood sugar or maybe meters, or, who knows, you can type anything and you'll be able to find lots of information. So bartonwebinar.com, Dr. Saunders, take it away, give us a disclaimer, and then you do your thing.
Necessarily applying to each one of you specifically. So just remember, when you're looking to something to apply it, work with your health professional or make sure that it applies to you specifically.
Did it cut out? Is it cut out for anyone else?
Yes, it cut out.
Okay.
And I just realized I'm super bright. So I'm not really this bright white usually. But anyways, what Dr. Saunders was trying to say was that, don't do anything crazy from what we say. Your situation is unique, and work with your own healthcare provider. And we disclaim any liability that may happen.
Okay. All right, can you hear me now?
No. Yep.
Yeah, I think we're good to go.
Yeah, it was just a little choppy.
Okay.
So, hey, go ahead.
Go ahead. What were you going to say?
So I'm only going to be on for maybe 10 minutes or so as we're driving to an event that we are a part of today. May or may not be a golf event. Hallelujah. But no, it's going to be fun. But I have a question regarding blood sugar monitors because I got a new one recently. It's the same kind that I had before. It's a Foracare 6, I believe, which came recommended by actually Dr. Annette Bosworth, who began into keto and blood sugar monitoring and all that. But I tested my blood yesterday and with my old one, and it was like 107, which I figured wasn't too bad because I had eaten some food, I don't know, half an hour before that. And then I'm like, well, let me test my new monitor just to see if it's consistent. And it came in at 80. I'm like, oh, that's a lot different. It was like a minute later. And so, is that normal, or like there wasn't anything to calibrate it necessarily? It was that part didn't need any calibration or whatever, but like, is that normal to have that big of a fluctuation between monitors, or could it be the age of the test strips or something?
All of that is possible. The age of the test strips, the monitor itself, your blood sugar's going up and down constantly, and a minute later it can still be an issue. So they aren't that accurate. They aren't accurate enough to say, the 85 is an 85. 80 kind of gives you an idea of, well, it might be somewhere between 70 and 90, somewhere in there. But and the 107, same kind of thing. It might be around 100 somewhere.
Yeah.
But you can't take it as an absolute. They aren't that accurate.
Yeah. Okay. Thank you.
You're welcome. Okay. And that brings us to the type 2 basics. I had a patient in my office who is on the Barton program. He started it and he's been listening to our programs, and he said, but I have a question. What is insulin resistance? And I'm like, what? You've been listening to our programs? You don't know what insulin resistance is? He's like, no, I don't understand. What does it mean to be resistant to insulin? So I thought that would be a great for our topic today on the basics of type 2. What is insulin resistance, and what exactly does that mean? Okay, so remember we had the sink analogy where your sink is overflowing. The resistance to insulin is the clog in the sink that you have. That you have this clog doesn't allow the water to drain out like it's supposed to. Well, let's talk what insulin does. So you have a cell, and insulin is what attaches to the cell and opens the door. It's like a key. It opens the door to allow sugar into the cell. So then you have sugar going into the cell. The more insulin you have them all over the place, then the more sugar you have going in all around this cell. And at some point, when you keep eating and eating and eating, and you're not exercising, so you're not using up all that sugar in the cell gets full of sugar. So it's like completely full of sugar. So the nucleus of the cell says, we're really full of sugar right now. We don't need any more sugar. So let's block off those insulin receptors. So then they block the insulin receptor from the inside. So the insulin comes and says, okay, open the door to let the sugar in, but it's locked from the inside, and it can't let any sugar in. Does that make sense? So now what do you have? You have this insulin coming and attaching to open the door, but it can't open the door because it's locked from the inside. So the sugar, so you're eating sugar, but it can't get into the cell, so it stays in the blood. And as you eat more, it gets more in the blood. And you eat more and it gets more in the blood. But it's not going into the cells like it's supposed to. So the blood sugar is going up and 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 up. And so that's where it starts spilling into the urine, and that's where you get diabetes. So you have a lot of insulin around. In fact, I've had somebody, a normal insulin level is like 5 on a fasting specimen. I had somebody who was 160 on a fasting specimen. High is like over 10. 25 is really high. I've seen 30, 50, 60, but I've had people over 100. So their pancreas is just pumping out insulin like crazy, but all the doors are locked from the inside, so that key can't open it. So the insulin is useless, and that's what insulin resistance is. The cells are literally resisting the insulin to not let sugar in because they're too full of sugar already. So if you think about that, then there's an obvious solution to insulin resistance, and that is, number one, use up all the excess sugar in the cells. Once you use up all the sugar in the cells, then the nucleus says, ha, we need more sugar, and unlocks from the inside so that the insulin can then work from the outside. Open the door and let the sugar in. Number two is to not eat so much sugar. Don't allow so much sugar into your body so that you can use up all that sugar in the cells. And once there's not quite enough of it, then the cells will go, I need some more. And then you can get rid of your insulin resistance, and you can have insulin sensitivity. So that's the idea of phase 1 of our program. When you're on phase 1, you're not taking in very much sugar. It's a very tiny amount. 20 grams is a very small amount of sugar. It's not enough for your body to run on. So your cells are not getting enough sugar, and there's not a lot of sugar outside in the blood. There's only a little bit there. So the cells start using up all their stores of sugar, and then they start opening up the ports for insulin and allowing insulin to unlock to start letting sugar in. So you can reverse the insulin resistance in phase 1 of the program. Now, how do you know? Well, that's one of the issues that a lot of people ask, is they want to know, well, how long do I have to be on this phase 1 of the program? And that depends on where you started. Some people are mildly insulin resistant, and so after 1 week on phase 1, they're like, oh my gosh, my sugar is consistently between 70 and 90. What that means is that there's plenty of space when you eat for the sugar to go into cells, and so your body will tend to keep it. Your pancreas wants to keep that blood sugar always around 70 to 90. And so when you find that consistently, then you know you're no longer insulin resistant, and things are working okay. So that's what phase 1 of the program is. Then you can move to phase 2 once you have that consistent 70-90. So if you're in Canada or parts of Europe, the sugar is between 4 and 5. If your fasting blood sugar is consistently between 4 and 5, that's the same as 70 to 90 on the US machines. So that's insulin resistance in a nutshell. Any questions?
This is so good.
It's really good. Yeah, it's good.
Gregory says
it's almost
great
like your body has your body has a switch that it flips or something to shut off, the insulin uptake. And I find what's interesting is that many doctors will, when somebody's insulin resistant, their prescription is give them more insulin. What sense does that make? That doesn't sound like a good solution to me.
I know, that's exactly, you know what, that makes a lot of sense to you and me because we know what's going on. But if you're a medical doctor and you don't know why somebody's insulin resistant, and you don't know the difference between type 1 and type 2 diabetes, then it makes sense to give them insulin. Oh, their blood sugar is high. They probably need insulin.
It's good. Okay. Denver Williams joining from Orlando. Hello. Karen is from Ridgeland, Mississippi. Hi, Karen. Lots of people on today. Brian said these basics are always great to cover. Gregory said great explanation, and Brian says, Joe, you need to get a tan. So there you go.
I'm gonna go work on that right now, actually. So just wanted to hop on and say hello. You guys have a great rest of the webinar today, and I'll watch the replay. So thanks, guys.
Thanks, Joe.
All right. See you, Joe.
Yeah. All right.
Okay. Let's see. We do have a question. So I'm going to get into a couple of these questions while we're here. And if you're on Facebook, feel free to ask questions there as well. So Meg says, my Nervala order, this might be, let's see, my Nervala order left South Dakota Monday, but will not arrive until Friday. So all week it's been in hot temperatures and will arrive here on a day above 102. Dr. Saunders, is the heat a concerning factor with this formula? How will I know if there is a problem? I may have to leave for a doctor's appointment, so please reply in the video. Thank you.
Okay. The question is benfotiamine, a fat-soluble vitamin B1, and an alpha-lipoic acid, which make up the Nervala, are they heat stable? And yes, they are. 100 degrees is nowhere near what it would take to destroy them. So, yeah.
Okay.
That's
good to know. It's very good to know. Okay. And is it possible to stop the insulin resistance no matter how long a person has had diabetes unless their pancreas is bombed out?
Okay. That's an excellent question. So a bombed out pancreas means you're not making insulin. That's type 1. That's an entirely different situation. You can have type 1 and type 2 where you don't make insulin and you have insulin resistance. You can have both of that. But what we're talking about is people who have high insulin levels. Their pancreas is saying, hey, we got to get this sugar out of the blood and get it into the cells. But the cells have all blocked it off so that you can't get it in. So the type, no matter how long you've had it, if you've had it for 20 years, you can totally reverse it on phase 1 of the program. It still reverses because all you need to do is use up what's in the cells and not add in too much, and then the cells will open up and you'll become sensitive to insulin again.
I love it. So there's always hope. There's always hope. This is good. This is a good transition here because Brian is saying now would be a good time to talk about the differences between type 1 and type 2. So let's do that.
Okay, so type 1 is where your pancreas does not make enough insulin. So instead of having this cell full of sugar, you have all of this sugar outside that can't get in. The cell's going, I'm starving. And the sugar is all out here, but there's no insulin to unlock the door and let it in. So there's no insulin there. It can't get in. There's no way for sugar to get in the cell without insulin. So that's type 1. There's no insulin. So the cells are starving. And type 2 is exactly the opposite. There's so much insulin all over the place and sugar is just going in the cell and the cells are bloated. They're big, they're fat. So these are they're really like type 1 is the opposite of type 2 when you look on a cellular level.
Okay. Let's see. We did that one. Marilyn says, I've been pre-diabetic for 9 years. Excuse me. A1C is the only input. No meds, no tracing at home. Is this right? Am I doing this right?
Well, that's okay. I would be curious to know what your A1C is to be able to say. So pre-diabetes is generally A1C of about 5.7 to 6.4, somewhere in there. So if you've had nine years in that range between 5.7 and 6.4, then you're considered pre-diabetes, and you don't really need any further treatment. You don't have to do anything more, but there are some things you can do to help. And something that's really important in this kind of a case is you want to avoid complications of this. And pre-diabetes, you can still get complications. You can still get kidney problems and Alzheimer's disease and poor circulation. So you still may need the benfotiamine and alpha lipoic acid. You still might need Nervala. And turmeric is actually as good as metformin, even better in some ways. The medications increase the insulin, but turmeric decreases insulin resistance. So you get more insulin sensitivity with turmeric, and which you don't get from the medications. The medications actually cause more insulin resistance over time. So you can just add in, instead of using stuff like metformin or drugs, just add in turmeric and then the cinnamon, the cinnachroma. So cinnachroma has all of the minerals that are needed for you to use sugar efficiently in your body. And then it also has cinnamon to help the improve insulin resistance, and then add turmeric to that. And then if you do phase 1 of the program, remember, you can take all the pills you want, but if you're not doing the diet, if you're not sticking to phase 1, you may still have insulin resistance when it's all over.
I know we've had a couple messages come in for people who really want to meet with Dr. Saunders and go to his office. And I think it's okay that I would say this. He's going to recommend that you do what's in the diabetes solution kit. So truthfully,
I give it to my patients.
I mean, save your money, save your time, save your gas, and just start there.
Yeah. If you have questions, ask them on the program. There's people in my practice. I had a program where I had a nutritionist, a health coach, another doctor, and we had IV treatments and hyperbaric oxygen, and we had people on these programs, and we would get them all better in 6 months. But they're paying like $5,000 for this program, and they would, and by the time they were done, they were all better. And you know what I used? The diabetes solution kit. Here, do this, and they would do it. But we would monitor them like they would come in every week. Sometimes 2 or 3 times a week.
And sometimes that really helps.
Yeah, sometimes that helps. Some people need that. Some people need that.
Yeah, if you can do that, then you should do that.
And the book, it's like $20 for the for the book. I can't tell you what a great value that is. That's just such an incredible value.
So good. Okay, question from Krish. Let's see. Asians in general frequently eat eggplants. Dr. M. Gundry, however, advocates no eggplants and also tomatoes in light of gut health. Also, here's my fun word. You're not gonna say it for me? Okay. Let's see. Butyric acid, absolutely essential for gut health. What is your take on these?
Butyric acid. Okay, so absolutely, butyric acid is really important. The good gut flora, bacteria in your bowels make this butyrate, which is so important for gut health. Lowers inflammation, prevents you from getting colitis and irritable bowel and other stuff. It even affects your brain. So yes, that's really important. Lectins are an issue, and some people react to them very badly. And so I've had people that I've had to get off tomatoes and eggplant and peppers and potatoes just because they did not tolerate nightshades. And there's a specific lectin on them called solanine that is for some people is quite toxic. So Dr. Gundry, who's also from Santa Barbara, he's from my area of town. That is correct in a way, but you have to remember one other thing, and that is people have been eating these foods for thousands of years. And in fact, the longest lived people in the world tend to eat things like beans, which are full of lectins. In fact, if you were to eat like a handful of raw red beans, you could die. The lectins in them, they're quite poisonous. But there's something else that's really important, and that is when you prepare things properly, you soak the beans, you pour off the liquid, and then you cook the beans for a long enough period of time. The amount of lectins is minimal, and things that are toxic in high doses are sometimes important in very low doses. And so one of the things that lectins do is they bind to the cells in your intestines, and they're signals. They're telling your body what kinds of nutrients are there. They're signaling what kinds of enzymes need to be made. So it's not a simple question of, yes, these are toxic. Well, in high doses, anything's toxic. There was a woman here in California that died from water toxicity because she drank too much water. So you can get toxic on anything you get too much of. So when you look at that, if you react to nightshades, then yeah, you should not be eating tomatoes and potatoes and peppers and eggplants and tobacco. Those all have this solanine on them that can be toxic. However, if you don't react to it and it doesn't bother you, then it shouldn't be an issue. So a lot of that is just taking something that's true for some people and applying it too broadly. And we see that a lot in health care.
Today's Fixed Blood Sugar webinar is sponsored by Synachroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synachroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synachroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synachroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synachroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synachroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synachroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
We have a question from Gregory, and this will be kind of good to address. If someone is looking for a doctor, they want to find someone like you local, what do you recommend? He's asking if you have any buddies in Minneapolis, Minnesota.
Not Minneapolis.
Doctor buddies.
But you know what? There was the Institute for Functional Medicine. If you go on their website, they'll have a list of doctors in your area, and they'll have a search there. Search for a doctor in my area, for a functional medicine doctor, and those who do functional medicine are, I think, the next level up from the ones that do integrated medicine. And integrated medicine is okay, but that's more of integrating different modalities, and they tend to just exchange, like, instead of your high blood pressure medication, they give you hawthorn berry extract. They just like exchange an herb for a drug or a vitamin for a drug, and you still go home with an armful of pills and you're popping pills all day for each symptom you have. Whereas a functional medicine doctor wants to restore function and say, what is the bottom line here, and how do we get your metabolism working right again so you don't have diabetes anymore?
Okay. That's good to know. Okay. Let's see. Brian said, can one have insulin resistance with type 1?
Yes. Yeah, you can. In fact, I've seen it several times. People who have type 1 and they're injecting insulin. And I had a woman on 200 units of insulin a day, which is 10 times what a normal diabetic would inject. So she was very insulin resistant, and still her pancreas wasn't making any insulin. Usually, though, if the cells are starving, then most of the time that's not the issue. It is not insulin resistance. However, if you listen to the doctors, and I have one patient who had this, she listened to her doctors, and her insulin resistance was going up and up. She was using more and more and more and more insulin to try and get her blood sugar down, because they said, eat whatever you want, And if your blood sugar goes up, just take more insulin. And so she was doing that, and she was getting up to really high doses of insulin. I'm like, no. So we had to go back and lower her insulin resistance. And now she's on a minimal once a day dose of insulin, and it's working pretty well. And she's type 1 because she has autoimmune diabetes.
Okay, Paul says, I don't have a question, but I just want to comment on how much everyone has been a blessing to me over the last 7 months. Dr. Saunders is fantastic with all of his wisdom that he shares with us. God bless you all.
Oh, thank you.
Paul. Thank you. That was so good. Okay, we had a question. Joe actually had asked this earlier today. Would any of our supplements help with rheumatoid arthritis?
Okay, so remember functional medicine. With rheumatoid arthritis, yeah, if you go to an integrative doctor or an herbalist or something, yeah, they'll put you on turmeric. Boswellia has been shown to work as well as naproxen. But again, those are just treating the symptoms possibly and not dealing with the root cause. So you're still best off looking for what is the root cause. Why do you have rheumatoid arthritis? So I've had people with rheumatoid arthritis that are reacting to something they're eating, and one of them was tomatoes. I had a woman who we put her on an elimination diet and just tried her off of nightshades. Well, we tried other things first, like wheat and dairy, and none of that worked. But she got to nightshades and went off the nightshades, and her arthritis cleared up, and she's like, oh my gosh, I'm not stiff anymore. I can move. So, and she said, then she ate something that had some tomatoes in it, and she goes, oh, there's just a few tomatoes in there. And it all came back, and she was stiff the next morning. She's like, okay, I get it. No nightshades for me. But it could be other things. Wheat is not uncommon. Dairy is another protein that can cause those reactions. There are other lectins in nuts and seeds and grains and cereals. So, looking for the why you have rheumatoid arthritis is the best way to go by far. And for the symptoms, you can use turmeric, which is a pretty good anti-inflammatory. And then I said boswellia, which is a frankincense, is both of them, turmeric and boswellia. In fact, you can get some now that have both of them together. And they're as good as any anti-inflammatory and don't have the side effects of thinning your blood or causing ulcers.
Okay. Let's see. We had a question come in from, I believe it's Roland. This was an email. He was talking about, or she, I'm not sure, I guess, but purchased Synachroma in the past, had some concerns about the high amounts of vitamin D3 that were in it, and was advised by a family physician that this was more than twice that was required. And so they're just kind of wondering why. Why is the vitamin D3 so high?
Okay, so vitamin D is very important for the utilization of sugar. It's not a vitamin, it's a hormone. And we think of it as a vitamin because you have to go out in the sunshine in order to make it. And so when during the Industrial Revolution in Northern Europe, when everybody started working indoors, they had light bulbs. They had so much pollution from everything they were burning that they weren't getting any sun. Even when they went out in the sun, they weren't getting any ultraviolet light to make vitamin D. So rickets was a problem, right? So then they found out that this oil from cod liver oil would cure rickets. And so they say, well, and they figured out what it was. And they said, this is vital to life. Therefore, it is a vitamin. That's where it got its name. So, this oil, whatever it is vitamin D, because the ABC, this is the fourth one, so it's D. But it's really a hormone. We make it in our bodies. We just have to get sunshine in order to activate it. Number one, it's a hormone. So what is the physiologic dose? Well, you have to think of your doctor is looking at very narrowly what is the minimum amount that it takes of vitamin D to prevent rickets. That's it. That's where that comes from. So So your doctor is saying that's twice what you need to prevent rickets. But that's only one thing that this hormone does. This hormone does a whole bunch of things. Vitamin D is an activator of macrophages. The vitamin D binding protein is macrophage activating factor. And if you don't have enough vitamin D, you don't activate macrophages. So during this COVID crisis, this pandemic, people who have good vitamin D levels do not end up in the intensive care unit. People with low vitamin D levels do end up in the intensive care unit, like at 85%. So vitamin D is the single most important factor to determine whether you're going to end up in a hospital dying or not. So there's another thing that vitamin D is needed for. How much does that take? What's a physiologic dose? Well, it turns out that you need a blood level of about 50. In order to get that, you need about 5,000 units of vitamin D a day. How do you get 5,000 units? Okay, go out in the sunshine on a summer day around noon, and it will only take about 10 minutes for you to make 20,000 units of vitamin D. That's 4 times what's in the synochroma. That's 10 minutes of sunshine if you expose a significant portion of your skin. But wear something, that's like, anyway, so the amount of vitamin D in the synochroma is the minimum amount that it takes to activate macrophages and to improve the function for blood sugar. So people taking less than that, they don't get the blood sugar benefit. So that's why it has that much in it.
Okay. We have another email from David. Let's see. He says, I started this program on June 15th of this year. And on July 16th, I started to average my readings in the morning for 14 straight days. The average was 138. In the evening was 133. The next day, July 29th, in the morning, it was 168. And then at night, it was 98. The next day, 141. At night, 147. So it's kind of all over the place. It says it's going from 164 to 127. Why for almost 14 days is the average 134? And then these last days, it started to jump all around and go up.
Okay, so I can make guesses, but you got to understand that the blood sugar in the body is not one. It's not a one-to-one, like I ate this much, therefore my blood sugar is going to be this. Nor is it I have this much insulin, therefore my blood sugar is going to be that. There's a lot of factors. There's incretins and insulin and glucagon, and then how much you eat, and then there's glycogen putting out insulin, putting out blood sugar into your blood from your liver, and then you have glycogen in your muscles adding to all that. So there's so many factors involved in what your blood sugar is. But so let me make it just. I give you an idea of the best guess that I would have here. When somebody's insulin resistant and they're eating fairly consistently a certain diet, their blood sugar doesn't change very much. It's going to be fairly consistent all the time. That's not necessarily a good thing, that consistently elevated, because that actually prevents you from making the glucose transport proteins in your brain, and you can end up with Alzheimer's if you have a consistently high or consistently elevated blood sugar. You really don't want that, and I see that a lot. And usually it's around 190, 200. People are very consistent when they get that amount of insulin resistance. So now you start doing the diet, you start getting more insulin sensitive. So now the insulin attaches on there, and all of a sudden your cells are sucking sugar in, so it drops lower. And then you release glucagon, so then your liver makes more. So then you're going up, that you're kind of chasing it around. Your pancreas is making this extra insulin, and it's dropping too low, and then it has to put out glucagon to make it go high. So this your own body is, as it's changing insulin sensitivity, It's creating the problem. Well, it's not really a problem. Actually, it's probably a good thing because you want it to go low sometimes because that's what stimulates your brain to make those glucose transport proteins. So I think that's a good thing.
Okay. And also, he had another question where he is asking, should he be eating something before he goes to bed?
No. No. Actually, allow that system to work right because actually it's a really good thing when your glucagon tells your liver to start putting out some sugar and your blood sugar goes up from that. You're using up because those cells in the liver are filled with glycogen. That's the storage of sugar, and they're fat. And so when your glucagon kicks in and starts taking out that sugar, then the cells can relax a little bit and shrink down. So no, don't eat anything. Don't try to use food to control your blood sugar. It's really, really well done by the pancreas and the liver. The system that's set up is a beautiful system if it's not poisoned. So just unpoison it. Take out all the extra and let it function properly.
Okay. Question from Brenda. How can I eat to rebuild my myelin on my thalamus gland that caused my stroke, but my neurologist never mentions how to rebuild it? Says my immune system is attacking it. Please help.
Wow. Okay. That is so, thank you for that. That's a really good, and a lot of people might want to know this. And that is, can you rebuild myelin? Yes. Take choline, choline. Choline is a supplement that's required to make that myelin, and it's often deficient in people. So choline, and then do the 6-10 reset. And that is no food after 6, go to bed by 10 o'clock, sleep by 10 o'clock, and then eat breakfast in the morning. So if you're going to eat 2 meals a day, eat breakfast and lunch, skip dinner, or if you have dinner, have a light dinner and early, like at 5 or something like that, so that you go to bed with an empty stomach, because that empty stomach will produce ghrelin, which will help rebuild the myelin, and it rebuilds everything in your body. It makes human growth hormone and all the anabolic hormones that rebuild your body. So do the 6-10 reset and take extra choline. And there are several supplements now that are really good, have combinations of phosphatidylserine, phosphatidylcholine, inositol, which are 3 things that you don't usually find in normal supplements or multivitamins.
Okay, good. These are good questions, you guys. Okay, let's see. We've got, okay, one second. Okay, Wayne is asking, is Banaba leaf supplementation a good option for lowering blood sugar? Unless it's banana
cool.
leaf.
Yeah, it's great. It actually works. And the studies show it's pretty good. And there's a whole bunch of things you can do. Berberine works really well too. Berberine would be a good choice. Banana leaf, ginkgo biloba. No, not ginkgo. What was it? The other one? Never mind. There was another. Anyway, and cinnamon. And so we formulated the Cinechroma. Partly to help lower blood sugar with a cinnamon extract, but you know what? The vitamin D and chromium and vanadium and selenium are very important vitamins to allow enzymes to function properly. And then if you do the diet, then everything starts working and you become insulin sensitive again. Whereas the Banaba leaf, even the cinnamon, yes, they make you a little more sensitive to insulin while you take it, but that's not the ultimate long-term solution. The long-term solution is still do the program, get the book, do the program. And I just want to reiterate that popping pills doesn't fix the problem.
Okay, Brian is asking, is high blood sugar an issue with type 1?
Oh, yeah, blood sugar, of course. You have in type 1, the cells are shrunken down and there's no insulin. So you have all this sugar outside and the cell is starving for sugar. I need sugar. But there's no insulin to allow the sugar to get into the cell. So what happens is the sugar in the blood goes up and up and up and up and up and up. So you have really high blood sugar, but there's no sugar in the cells. They're starving. And that's because there's no insulin to allow all that sugar in the blood. And it can go super high. I've seen 800. I've seen people with type 1 diabetes super high.
Wow. Okay. Let's see. We have Bill says a current CT scan showed plaque in all 3 cardiac arteries. My cardiologist wants to put me on statins and baby aspirin. Instead, I've been following the Israel protocol and taking 1 cup of pomegranate juice, organic, unsweetened, daily. The study showed that in 1 year, they reduced the plaque by 30% compared with 6% by statins. What benefit is the baby aspirin? Can I use something natural to get whatever the benefit of the aspirin would afford?
Okay. The only thing the aspirin does is prevent the platelets from coagulating inside your veins and arteries that causes clots. So the purpose for the aspirin is to prevent clots. That's really all it does. It doesn't really do anything for the cholesterol. And so the idea is that if you're forming clots, then those clots, if they move somewhere, then they can get stuck on a plaque somewhere and block up an artery. So really, if you can reverse the plaque, that's a better idea. Statins have not been shown to reverse plaque. The best that any study has shown on statins is that it reduces the rate at which you form plaque. So you're still forming plaque.
Okay. Meg is wondering if there's a relationship between diabetes and cataracts, and can cataracts be reversed with nutrition?
Oh, good question. There is no direct link between diabetes and cataracts. The indirect link is if you have low antioxidant potential, especially the water-soluble antioxidants like glutathione, then you will tend to get cataracts more easily. So there is like nutritional deficiencies or something that are related to cataracts. Vitamin C is another one. And so people who are on diets that tend to cause type 2 diabetes will also be low in these antioxidants, so they will tend to get cataracts. So association is not causation, so one doesn't cause the other. And then the corollary to that is, can it be reversed? Well, number one, making sure you get enough of the nutrients that you need, making sure you have enough vitamin C and selenium and all the carotenoids. So you're eating green vegetables, fruit, getting plenty of that every day. And then this is the key to reversing. There's some drops called carnosine eye drops. There's the brand name that I usually go for is called Can-C, CAN-C. And Can-C eye drops, it takes a long time. You put them in your eyes for about a year or more, and over time the cataracts dissolve. It's L-carnosine. It's actually an amino acid combination that's one of the things it does, reverse cataracts.
Wow. Okay. Krish is asking, what is the normal blood level of vitamin D? If one has it within the range, all one needs to take is 5,000 IUs for maintenance. Let me know whether the measure of blood vitamin D level is a good marker at all.
Yeah, the blood level vitamin D, 25 hydroxy vitamin D is a decent measure to see what it is. That's not the active form. Your kidney actually makes it into the 125 dihydroxy vitamin D, which is the active form, which you can measure. But the problem is that one is so changing all the time that it's not a stable measurement. So the best way we look at it is if you're vitamin D adequate, which means you have enough around so that your kidney can make it into the 125, the active form. So your liver makes it into the, well, first your liver makes it into the, but your kidney activates. Anyway, so yeah, the 25 hydroxy vitamin D is a decent measure. And the number should be somewhere between 30 and 100. That's a pretty wide range. Optimal seems to be like 50 to 80. And it takes about 5,000 units a day to get to 50. And it takes about 10,000 a day to get to 80. And that's pretty much what I've seen. I've tested thousands of people. And so the blood levels of between 50 and 80 are optimal. So if you got no sunshine at all and you just took 5,000 a day, if you just took one synochroma a day, you would probably be in the 50 range, which is at the low end of optimal, but still clearly normal. When they did the studies, for example, on COVID-19, they looked at 30. If you were above 30, you had a 85% chance. If you got sick, you would not go to the ICU. And if you were below 30, you had an 85% chance that you would go to the ICU. So, and that was 30. That's pretty low. So 50's what you're getting in synochroma is plenty.
All right, a few more questions here. Glenn says, does a diagnosis of fatty tissue in liver relate in any way to this issue of diabetes?
Yes. Okay, fatty liver. So remember we were talking about type 2 diabetes, what insulin resistance is, how these cells are bloated and they're full of glycogen and they get toxic and they die. And it's converted to fat, and so then they have these cells that are dying. Everything is getting converted to fat, and so they have the fatty liver, this fat all over in the liver, and there's a turnover of cells in the liver, and that's okay. But type 2 diabetes is definitely correlated with fatty liver. That's a correlation, not causation specifically, but having the metabolic defect does increase getting fatty liver. It's called non-alcoholic steatohepatitis or fatty liver.
Today's Fixed Blood Sugar webinar is sponsored by Synochroma, our best-selling advanced blood sugar support formula. Now, thousands of people around the world are taking Synochroma every day as part of their program to fix their blood sugar using natural ingredients that simply work. Now, Dr. Saunders formulated Synochroma to meet key nutritional deficiencies that most people have unknowingly suffered from for far too long. With Synochroma, you get a blend of 6 key ingredients. The perfect combination of chromium, vitamin D3, and vitamin K2, which it's important to take those two together, selenium, vanadium, and our 10-to-1 cinnamon bark extract. Now, if you're not already using Synochroma, I highly recommend that you give it a try and see how it helps your energy, your weight, and your blood sugar numbers. You can get Synochroma at bartonnutrition.com or on Amazon. If you get it at bartonnutrition.com, you can enter the coupon code webinar25 and you'll save 25% off at bartonnutrition.com. But I realize some people like to go to Amazon as well. So anyways, Synochroma, highly recommend. Now let's get you back to the Fixed Blood Sugar webinar.
Brian is asking, my wife has type 1, no pancreas, and her blood glucose might go to 15 plus. and as low as 2.7. She takes 6 units of insulin in the morning and 3 units before each of her 3 meals. In the case of low reading, she takes, I'm assuming, shakes to raise the blood sugar. Would it be better to do nothing and let the body mechanism take care of it? The 6 units is long-term and the 3 before meals is short-term.
Okay. So now you're talking about type 1. Okay, so type 1, there's no insulin. So there is no body mechanism to handle this. So that this isn't something that you say, oh, the body's really good at handling it. No. If there's nothing that's going to work from the inside, which it's not going to be managed from the inside because the pancreas is not making insulin. So you have to manage it from the outside. In that kind of a case, there's a book called Mastering Diabetes, and it's written by 2 young men who have type 1 diabetes. And they tell you how to have a very constant blood sugar and while using insulin without having to chase it around like usually happens when you're using a sliding scale or just letting it happen. So it's a whole program. It's not just like, just do this. And it's not quite as simple as what we've done with the Diabetes Solution Kit. So the Diabetes Solution Kit can be helpful if you're type 1 and you're on a very low carbohydrate diet. Then it's kind of easier to keep your blood sugar more stable and more in the range because you want it to be between 4 and 5, and 2 is too low, and of course 15 is way high. So you want it to be between 4 and 6. Ideally, so you can do that with the Diabetes Solution Kit, but try the book, or at least read the book Mastering Diabetes, and because that's really, there's the people that wrote it are type 1, and they've found a really good way of managing that.
Oh, that's great. Okay, you guys, that is all for us today. Wonderful questions. This has been very good. We've gotten a lot of new questions that we haven't had. So thank you guys. Dr. Saunders is going to take off and go meet with some of his clients. And so we thank you again, Dr. Saunders. We'll see you next week.
You're welcome. See you next week. Bye.
Bye-bye. And all of you, again, thanks for joining. Make sure that you come back. Remember, we have bartonwebinar.com where you can find all of our webinars that we have recorded. They're on our YouTube, or there's a link to our YouTube channel there. You can also find a link to all of our supplements. There is a code webinar25 that you can use to get 25% off of any of the supplements there. And again, if you have not already purchased the Diabetes Solution Kit, I'm telling you, it's the best money you'll spend. It is, it's very good. It teaches you how to eat through these different phases to better manage your blood sugar. So that's all for me. Thank you guys for hanging out, and we will see you next week.